Diabetes, what's it? What causes diabetes? What are the symptoms? Hi. My name is Kelly from Feel Good channel. In this channel I bring information that can make you feel good. Today I'm going to talk a little about diabetes. What's it? What causes diabetes? What are the symptoms? Diabetes is a disease characterized by high blood glucose, hyperglycemia. It can occur due to defects in the secretion or action of the hormone insulin, which is produced in the pancreas by so-called beta cells. The main function of insulin is to promote the entry of glucose into the body's cells so that it can be used for various cellular activities. A lack of insulin or a defect in its action results in an accumulation of glucose in the blood, which we call hyperglycemia. We know today that several conditions can lead to diabetes, but the vast majority of cases are divided into two groups, type 1 diabetes and type 2 diabetes. Type 1 diabetes, DM1, this form of diabetes is the result of the destruction of pancreatic beta cells by an immunological process, that is, by the formation of antibodies by the body itself against the beta cells, leading to insulin deficiency. In this case we can detect in blood tests the presence of these antibodies, which are ICA, IAAs, GAD and IA-2. They are present in about 85 to 90% of DM1 cases at the time of diagnosis. In general, it usually affects children and young adults, but it can be triggered in any age group. The most characteristic clinical picture is a relatively rapid onset, a few days to a few months, of symptoms such as excessive thirst, diuresis and hunger, significant weight loss, tiredness and weakness. If treatment is not carried out quickly, symptoms can progress to severe dehydration, drowsiness, vomiting, breathing difficulties and coma. This more serious condition is known as diabetic ketoacidosis and requires hospitalization for treatment. Type 2 diabetes, DM2, this form of diabetes includes the vast majority of cases, about 90% of diabetic patients. In these patients, insulin is produced by pancreatic beta cells, however, its action is hampered, characterizing a picture of insulin resistance. This will lead to an increase in insulin production to try to keep glucose at normal levels. When this is no longer possible, diabetes arises. The onset of the condition is slower and the symptoms, thirst, increased diuresis, leg pain, visual changes and others, may take several years to appear. If not recognized and treated in time, it can also progress to severe dehydration and coma. If you are enjoying this content, please leave your like and comment. Unlike type 1 diabetes, there is generally an association with weight gain and obesity, affecting mainly adults over 50 years of age. However, the development of the condition is increasingly observed in young adults and even children. This is mainly due to the increased consumption of fats and carbohydrates combined with the lack of physical activity. Thus, the endocrinologist has, more than any other specialist, the chance of diagnosing diabetes in its initial phase, given the large number of patients who seek this professional for obesity problems. Other types of diabetes are much rarer and include genetic defects in beta cell function, MODY1, 2, and 3, genetic defects in insulin action, diseases of the pancreas, pancreatitis, pancreatic tumors, hemochromatosis, other endocrine disorders, Cushing's syndrome, hyperthyroidism, acromegaly, and use of certain medications. How can I know if I'm diabetic? To be sure you have diabetes, you should see an endocrinologist. This doctor will order laboratory tests that will indicate whether or not you have the disease. How to prevent diabetes? The best way to prevent diabetes and many other diseases is to incorporate healthy habits. Encouraging a healthy, balanced diet and physical activity should be a priority. Use of natural products can also help prevent blood sugar from rising. Betabeat, for example, has in its formula 8 clinically proven ingredients to support healthy blood sugar, increase your energy, stimulate your metabolism and assist in fat burning and weight loss. I'll leave the official website link in the first pinned comment so you can know. Buying Betabeat with 90 or 180 days supply, in addition to saving money, you get free shipping. Betabeat comes with a full 60-day guarantee. You can try it and see its blood sugar restorative effects with absolutely no risk. If you are not totally and completely satisfied with the product or its results within the first 60 days, just contact support and they will refund 100% of your money. Remember, all information presented here is for informational purposes only. Consult a trusted doctor to receive proper guidance about your health status. I really hope you feel good. Bye-bye.